people are just really facing life challenges and should have the opportunity to actually face these challenges, and therefore, as that, all they need to know is that we need to just convince them that there is still hope in palliative care. There is still hope to die dignifiedly. So on the idea of sanctity of life, right, we say that the government has the responsibility to promote the opportunity for self-actualization. This is something that the government has already been actively doing in terms of in other areas besides this, right. Let's look at how the government opens up employment opportunities for people to improve their social status. How in education the government provides scholarships, because to overcome the barriers, the life challenges that they face, right. So why at the end of at the deathbed, why should the government turn around this principle of allowing opportunities for self-actualization at the deathbed by just conceding to the fact that there's no hope. There's no hope in dying in dignity, right? It's a form of contradiction on the idea of the service, the purpose of the service of the government, right? Life challenges are normal processes of life. Overcoming it achieves dignity. That's what the government should be promoting, and it's already been promoting in other areas that the government deals with, right, in society. So why there is no reason why the government should contradict this kind of principle, and at the end of these patients' lives will not allow for the opportunity for self-actualization, because we believe that under the status quo, we can actually achieve the self-actualization because of the fact that there's opportunities for them to spend their last few moments with the family, come to terms with how their life has been spent, progress through the stages of death, naturally, instead of taking advantage of them, instead of allowing them to just give up at the denial and grief stage and not go forward to the compromise and acceptance stage of death, right? We believe that they should be allowed to go through all the stages of death to actually die with dignity. So if we deprive this opportunity, right, we are not being the government that we should be. There is no compassion. There is a contradiction with principle of service. So the burden of proof of the government is to tell us why we should retract this kind of service, the role of promoting this self-actualization, the tangible benefits, and also on the tangible benefits of their proposal. Because under our paradigm, we are actually allowing them the opportunity to die with dignity, right? Because that is what the government the government has been doing all this while, and to allow these patients who are classified as unsound to actually make a decision about taking their own life is something of a big matter. It's something an irrational government would do. And also providing, we are the ones who provide a chance for a better quality of life, to end with a better quality of life and a chance to die with dignity. With that, the opposition opposes.
Speaker spoke for 7 minutes 50.
Can you guys hear me?
Yes.
Behind? Cool. The last claim that side opposition had to give was that they allow patients to now die with dignity. They always had the choice, right, ladies, gentlemen? They've always had the choice whether they wanted to take palliative care, but they've never had the choice to take assisted suicide, the act of euthanasia that might end the suffering that they have. So don't you dare come up here and tell me that you're providing patients with a choice. That choice was always there. We are now expanding it to more than one choice. And with 2 choices, we now have more ways of telling patients how they can end their lives if they want to. Before I go to my substantives, a few rebuttals. The abhorrent thing that came out in their speech was equalizing the state of mind of a patient who wants assisted suicide to a person who has a very simple case of depression. People get depressed over a whole variety of matters. Relationship problems, financial problems, death of a relative maybe, and all of these things pass with time. What does not pass with time, ladies, gentlemen, is fourth stage bone cancer. It's the kind of disease that consumes you in the last days of your life. That simply does not pass like a financial problem. So I find that characterization abhorrent and dismissive. But to go on more, right, on the POI that my PM asked, patients oftentimes choose to die at home in pain and suffering, as statistics show in many countries. And all they had to say to that was that they weren't informed. We think that's untrue. We think that patients generally try and die at home because the bond of trust between the patient and the doctor is suddenly broken. Or one day you're receiving treatment from the doctor, and when you come to that last treatment, the last merciful dose of morphine that you want, all of a sudden the doctor says, my hands are tied because the government tells me so. Or a bunch of people who have never met you suddenly tell you what drugs you can or cannot request. We say that that bond between the medical society and the doctor is broken, and that makes for a very bad situation. But then they tell us that they want people to progress through life in the natural way. We say that the progression of life in a natural way is not always perfect, right? And that brings me very nicely to my first point. It prevents patients from attempting suicide. It's heartbreaking when a patient who just wants to die is trapped in a jail of his or her own body and that of the expectations of society. Now, death does not have to be a messy affair, right? As it often is in bone cancer, the patient lies in the bed, screaming in pain until his or her last moments, incontinent, wetting the bed, disgusting his or her family members. It really doesn't have to be. That natural course of life can be replaced by something a lot cleaner. Imagine this, instead of waiting for your organs to betray you one by one, we offer an alternative. If the patient is fully informed and fully conscious of his or her own decisions, you are able to select when you die. And this allows for a whole bunch of benefits. Consider, people, how many times have we had that family member who just died all of a sudden? The friend who died in a car accident, we never got the choice, the chance to speak to them one last time. Now we give these people a nice clean death, the chance to have this last discussion on what their lives have all been about, instead of waiting for death to snatch it away by some random chance. And we think that this is important because with the advancement of medical care, we can now give people different ways to end their life, creating a more humane way to die. Go.
Sir, how sudden death, how is that different from your policy when this person are also...
Hundreds of videos have literally come up showing people in the last stages of their life. They were able to choose when they died. They were able to have this last discussion with the family. The distinction here is that if you've got bone cancer or you die in a car crash,